السلام حياة قد جاء في القرآن أن السلام.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the last show of this year with iTREND on ITV. It's such a pleasure to be here. It's been a pleasure hosting the show for this year. It's been absolutely wonderful. I think being the last show, we have so many things to discuss, preparing us for the holiday period, but we'd be completely remiss if we didn't mention two things before the start of the show. The first being the 16 days of activism. And I think this is something that we shouldn't only prepare or look forward to, or not rather look forward to, control the awareness of during these 16 days, but we need to focus on it throughout the year. We need to make sure that gender inequality, gender abuses are talked about, are spoken about, and we need to make sure it stops throughout the year. And this is the time to raise awareness, to find those organizations that are targeting and looking after women and children in these situations, and we need to help donate and do as much as we can for them. The second thing that we need to mention, which is something that we've all been hearing about and seeing about, is what's happening in Palestine at the moment. Our du'as are with all our Muslims, brothers and sisters. May Allah subhanahu wa ta'ala make it easy for them wherever they are, inshallah. Today in our studio with us, we decided to bring you something that would make your holiday period a little bit easier, but to make sure that we take care of ourselves along the way as well. So we have two very dynamic ladies who are in the forefront of the industry, Dr. Aisha Kola Adam and Dr. Muazza Umar, who are from the Crosby Medical Clinic, joining us in studio today. Assalamu alaikum and welcome to the studio.
Walaikum salam.
It's such a pleasure to have you both here. Tell us a little bit about yourselves. I know you've been working together for a very long time. We always see the Crosby Medical Center up in the forefront of things that are happening on skincare, specifically targeted towards people of color. Tell us a little bit about how you started and why you decided to go down this road.
Aisha and I studied together at Wits, and then our paths crossed later. A few years later, when our kids were young, and Aisha and I were both doing locums, and we still wanted to work and obviously be good mothers and
Have
wives.
to balance it all.
Yeah, and tried to be flexible. At that time, we were doing locums, and then we realized that we live down the road from each other, and why don't we start something that's going to be close to home and where we can serve the community and still be working mums.
Alhamdulillah.
So that's when Crosby Medical Center started.
And how long has it been since Crosby Medical Center's opened?
It's 11 years this year.
Wow.
Yes. So it's a long time. We started off initially as being GPs, just doing your average medical consults and seeing your average medical patients. Subsequently to starting, we then realized that there was very much a need for women who wanted to look good, who wanted to feel good, who wanted to be comfortable in their own skins. And we realized that at that time, you know, weight was also a very big issue. Like a lot of women were battling with weight loss. It was then that we got started in doing a weight management program. And then, well, as things went by, it slowly progressed. And I think it's a natural progression when you start off as looking, you know, weight doctors, to then doing skincare, to then doing anti-aging, to then doing integrative medicine. So it was all a progression from there.
And this has also put you quite in the forefront of doing those kind of treatments and that for people. So obviously the need has grown within our community to quite an extent, with both men and women wanting to always look the best so that they can present themselves as being the best. Do you find that it's only in a certain generation, or are we spanning across generations where people are now deciding to look after themselves?
I think it's across all generations. More especially so now with the selfie generation.
Yes.
Everyone needing to take selfies all the time. Everyone needing to look good. Everyone needing to post on Instagram and social media. So that obviously is a big thing. So people then come to us and, you know, I need to look good in my selfie. Can you make me take these lines away? Or I need to have a better glow on my skin, or
bigger lips.
Yeah, bigger lips.
So
I
they
need to
do
have those
everything.
Angelina Jolie lips. So, you know, what can you do for me?
So you've mentioned a few topics that are quite relevant, and that we see a lot of people going through that. We see a lot of people calling us on the show about that as well. Let's discuss pigmentation, because that we're seeing, having a very harsh South African sunlight. I think it's something we don't realize when we're younger, because I remember growing up, I loved sitting in the sun. I loved just lying there. I loved, even when we were at university, just being out in the sun. And none of us are conscious of the fact that we need to have proper sun
Sunblock.
protection, and we think that, oh, if we're a certain pigment we should be fine out in the sun,
Yes.
and we don't realize the consequences that come off it later. Tell us a little bit about what you're seeing in terms of pigmentation.
I think in terms of pigmentation, it's a very common problem, and it really does affect a lot of women. And the big thing about pigmentation is that it really does affect their confidence. So you find a lot of people who have pigmentation look in the mirror and they hate what they look like, and they would do anything to get that pigmentation better. But I think it's important if we start at the beginning and we think about pigmentation, and it's important to know that there's different types of pigmentation. There's epidermal and there's dermal, which is deeper, and it depends at which stage you actually present. Early on, pigmentation is more superficial, it's epidermal, it's easier to treat, and there's a lot of treatments that are successful. Treating pigmentation that has been there for a long time is a lot more difficult because it then tends to go deeper into the dermis. And with that kind of pigmentation, we tend to get the skin lighter, but not necessarily completely removed. Also, there's a lot of different causes for pigmentation. So it could be hormonal, it could be secondary to pregnancies where patients develop melasma or chloasma.
Yes.
And then obviously the sun. The sun is a big contributing factor to pigmentation and to aging as a whole. So based on those, treatment is directed at different levels. So first of all, we talk about protection. You need to protect yourself against the sun and against developing more pigmentation. And for those kind of things, we do things like the glutathione drips, IV glutathione. We do topical antioxidants. And then to prevent, to prevent and protect, we always advise sunscreen.
Okay.
So no patient that comes to us who needs treatment for pigmentation is allowed to leave without a sunscreen.
Yes.
Okay.
Especially with the holiday season coming along.
I was just going to ask you, because
you
a
need
lot
to
of us are
prep
going
your
to...
skin before you go out on holiday. And you don't obviously want to be sitting with all the side effects when you get back from holiday. Then
Yes.
it's a little bit too late to treat. Obviously, we can treat it then, but obviously go in with prevention better than cure now.
And I know this sounds like such a simple question because we should know that it starts early. But at what age should we be even encouraging our younger kids to be using it? Because very often I find, like, if it's my children, they'll be like, oh, there's no sun out today, we're fine, we're just in the car.
And that's on the days where the UVA and UVB rays are actually much worse. And that's on the days that you need to protect and actually cover up with sunblock.
There's
on
been
those
a
days.
lot of discussion with regards to the type of SPF, because sometimes you read that, oh, at a certain point, the higher it gets, it doesn't make much of a difference. South African skin needs a different SPF. How does that work in terms of what we should be using or what we should be looking at? If our viewers are going out into the chemists or into the stores, what are they looking at when they're choosing an appropriate sunscreen?
Listen, I think with the sunscreen, you're looking for an SPF with 15 and above.
Okay.
So it
Minimum,
doesn't-
yeah.
Yeah, so it doesn't basically protect you from, it's not a time frame. So I think on the holidays, you've got to always remember that you need to top up on sunblock every 2 to 3 hours, and especially if you're going into the water and whatever it is, to top up more often.
Okay.
But when you're looking for a sunblock, you want to look for a broad spectrum sunblock where you're covering UVA rays and UVB rays.
Okay.
So the UVB rays are the rays that actually cause the sunburn and the sun damage to the skin. And UVA rays, you don't get much protection from sunblock for that, but that causes aging issues and filter
Yes.
damage to the skin.
So
that's long term.
okay, perfect. So that you've got it, you need to actually start sunscreen today, a
Yes.
few
Yes.
times a day.
All the time.
All the time. When you mentioned earlier also about the different types of pigmentation we get, you also mentioned having it sometimes due to hormonal issues. And I think many of us, as we're getting older, things change, our skins change. How do people deal also with skins that are changing? Because obviously, as we get into our 40s and 50s, we start dealing with aging issues. When we're in our 30s, it's a completely different ballgame. How do you manage to deal with this in the right way for each client that comes in?
It is very target specific. So, I mean, you're treating women in different age groups. So, yes, your treatment is specific for that age group.
Yes.
So, younger skins tend to need a little bit less in terms of anti-aging properties in their creams. And there you're really wanting to correct more acne, more blemishes, keeping skin moist, well hydrated. The older the patients get, they then need more anti-aging stuff, and then you would be using things that have more what we call your alpha hydroxy acids, which specifically target fine lines, wrinkles, and also plumps up the collagen, because you start losing collagen and elastin.
Yes.
So these treatments are then more specific for maintaining and plumping up the collagen. And then also, as women get older, I think it becomes even more important for them to then consider doing other treatments and not just relying on their home care.
Yes.
And other treatments would be doing chemical peels. Chemical peels become even more important when you're older, because older women tend to have a longer turnover of their skin cells. So the longer the turnover, because it's longer, you have more dead skin cells that lie on top of the skin, which makes it difficult for their products to penetrate. So by doing things like peels, they're actually exfoliating, stripping the skin off that dead skin cells, like giving a fresher look, a healthier look. It also works to plump up your collagen, stimulate your elastin, and at the same time, it also just allows for better, your product penetration would be that much better after doing chemical peels. So the older the patient is, the more necessary these in-house treatments become.
And it's important to invest in a good home care product.
That was, I was leading into the next question. Very often we go in, whether it's for spa treatment or whatever it is, and people are always saying, no, you just need to put this product on or that product. How would you choose the ideal product?
Listen, so the thing is, we always like to assess the patient's skin first. So everyone's skin is different. So aside from it being oily or dry or whatever it is, you also want to assess the type of skin using the skin Patrick's scale, you know. And generally, Indian clients are more sitting between type 4 and type 6.
Yes.
We are obviously also more prone to pigmentation. Indian skins generally pigment much sooner, and obviously that's where the confidence in issues come in. So we like to treat that early on.
Okay.
So using a good antioxidant, topical as well as IV therapy in terms of glutathione and all of that does help with that as well. But the home care range is important, because you can't just be doing in-salon treatments and then not taking care of yourself at home.
It needs to continue.
Yeah.
Absolutely. When we come back after the ad break, we'll be continuing asking the doctors all the questions we've wanted to know about skincare. You are welcome to call into the studio. It is a live show if you've got any questions. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back after that very quick ad break. We are chatting to Dr. Muazza Umar and Dr. Aisha Kaula Adam, who are telling us all about skincare. We've just discussed pigmentation, but one of the things that you mentioned both of you actually mentioned and you touched on was on glutathione. We see that coming up so often. I'm on Instagram, so I often see these adverts coming up for glutathione. What's the difference between the patches and having the drip? And also, how do you know which one's effective? Because we see so many brands coming out. How do us as consumers know how to make the ideal choices?
Okay, there are a lot of glutathiones on the market. There's injectables, there's oral supplements, there's patches, and there's the IV route. So with the training that we did, and we've done training as doctors doing integrative medicine, we've been taught that the IV is the most superior route. Glutathione, taken any other route, your skin tends to be the last organ of your body to get it. Okay, whether that's subcutaneous, as in by the patches, or IM, as in the injections, it goes everywhere else before it gets to your skin. Whereas the IV route bypasses all those other steps and goes straight to where it needs to get to. So in terms of efficacy, IV is definitely the most superior form.
We're seeing a lot more of the IV related options coming up repeatedly, where people are saying, oh, you can come in for an energy drip, you can come in for a vitamin C drip. Again, for us who are at home, who don't understand half of what this is, what does this mean for us? What are our options? What are the things that are good enough? What are the things that are reliable? What are we looking at?
So listen, IV therapy is quick. You've got an immediate onset of action. Whereas if you're taking a tablet, remember now with our lifestyles, stress, poor eating habits, a lot of it needs to be absorbed into the intestinal system, go through the first pass effect of liver, kidneys and all of that, and then be absorbed into the system. IV therapy is taken on because it's got a straight onset of action directly into the bloodstream, and you don't have to worry about metabolizing and it being passed through the kidneys and liver and all of that.
Are there side effects with this? Would there be certain patients that would not be feasible for them to have these kind of drips to be done?
Really, we've been doing it for quite a while and it's been very safe. The only IV that I think you need to be careful about is doing iron transfusions. Those you need to make sure that patients can tolerate that high doses of iron. That's about the only thing. In terms of the iron, patients can get headaches, they can feel a little bit nauseous, but that usually is well treated by them just keeping themselves very well hydrated. With regards to the other IVs, in terms of the vitamin IVs as well as the glutathione, the product is so safe. It's something that is produced by your body itself, so it's putting back what your body needs and what it has. It's nothing foreign.
Yes.
Okay, so it's pretty safe.
Earlier when we mentioned and we were speaking about the different types of skins that we are targeting and we're discussing, and I know very briefly we've touched on pigmentation. One of the things that we see many struggling with, not just in our youth, but even sometimes getting into our adulthood, is acne. And sometimes you often feel like, I'm sure I'm past the stage, and then you get into adulthood, you pass your pregnancies, and then again it starts all over again. Tell us about how do we even start looking at that? Is there something that can actually fix this? I wish there was.
Listen, acne is very common in the teenage years because of your hormonal surge, but I think we are seeing quite a lot of adult acne as well. So I think it is related to stress, hormonal imbalances, and basically it's an oversecretion of sebum from your pores. So there's different ways of treating it, and obviously you need to come in so that we can grade it. If it's grade 1 or 2, we do other things, sometimes doing oral antibiotics, doing chemical peels, doing a little bit of IPL, radio frequency. That does help with acne. Obviously, if it's then moved on to, progressed further into like a grade 3 or a grade 4 with more cystic acne, then we got to look at taking oral medication. So that's when Roaccutane and other medications would then come in. But if you start early, we can obviously prevent the progression from preventing it from getting to a stage 4 type of stage.
And then acne in adulthood.
Yeah, it's a known condition, adult onset acne, and that can happen to anyone. It doesn't mean that because I was acne free as a teenager, I'm not going to have acne as an adult, or vice versa. Because I had it as a teenager, I will get it as an adult. It doesn't follow any kind of rule, but there is a condition known as adult onset acne, and it can vary, same like in your teenage years, from grade 1 to grade 4, and treatment would be along the same lines. Early mild, moderate acne, you would want to put the patients, then you can use oral contraceptives. For female patients, they usually do respond nicely with that. You can also then use antibiotics. Some adult patients also need to go on to Roaccutane, okay? And then also combining that with other treatments. And I think with treating acne, the one thing we need to remember is that we need to treat it early on, and we need to treat it aggressively, because the ultimate aim is to prevent scarring. We know that acne can cause scarring, and you want to prevent that for the individual.
When you speak about, I think your setup, for me, what I love about it is the fact that it's very holistic. It's the doctors, it's the beauty care, everything all in one. So there's a good balance of a backup as well as a push going forward in terms of what's advancing. You mentioned earlier about laser treatments and chemical peels. How do people even know what the difference is? How do we know what to start with? Because very often we hear about these chemical peels going around, and then we also hear the side effects because it hasn't, people are going for the wrong things for their skin. They don't know that that may not necessarily work on black or Indian skin. So how do you know how to choose what's ideal for you? Because not everybody has got those setups where you'll have access to both the doctors and the therapists at the same time.
I think that's what Aisha and I enjoy, and that's when we got Sadia as our skincare therapist to come on as well, so that Aisha and I can do our initial consult, and then obviously Sadia will take the time to sit and do the peels and do the pampering sessions once Aisha and I have given her a nice treatment program to follow.
Yes.
So we like to assess the skin first, and from there, listen, Fraxel, lasers, all of that, that will be something that Zaheerah does on something on our request. Initially, we like to start off with chemical peels, but we like to prep the skin before you do such harsh treatments to the skin.
Yes.
And obviously now there's a move towards going green. So there's the green peel that's come in. Instead of using harsh abrasive chemicals on the skin, you go with more natural herbal products. But obviously, we need to assess the individual type of skin to see what works best for that skin.
Oh, I tried that green one. It's fantastic.
It's a lovely peel.
It's lovely.
Are you seeing, is it just a push with just women coming in, or are you seeing our men in our community, the boys also feeling like they need to be taking care of their skins as well?
Absolutely. I think that there's such an awareness with regards to good skincare and wanting to look good amongst our males in our community as well. And we see males wanting to do peels, wanting to come for laser treatments, wanting Botox, all of that.
Wanting the skin lightening,
wanting to do the glutathione drips. All of
It's
it.
everything.
It's everything.
When we speak about skincare, I know the one thing we've mentioned right at the beginning was the need and the importance of having sunscreen on your skin all the time.
Yes.
What are things that we can do as well for different, and I know very briefly because it's a loaded question, but if you are in your teen years and then ones that are in their 20s or 30s or 40s, what are the things that we need to be doing or making sure our skins have basic routine care? I know sunscreen would probably go right across all the generations, but I just find that there are different things, like my teenage daughter would need something completely different than I would use. So what would your recommendations be?
You're talking specifically about sunscreen
or just even in terms of products, because I don't know, skincare in terms of treatments, because I find that, you know, when we were growing up, we were always told you need to have a facial regularly.
Yes.
Now we're coming into ages where we're told, okay, go and get a peel because that will help it a lot faster and a lot quicker. So what are the things we should be doing at different ages?
I think from a young age, kids need to be taught the importance of good skincare, and that would be, using a good cleanser or face wash. And then using a good moisturizer and then a sunblock. Also, very important is to teach your kids about diet. Diet is essential for good skincare. What we eat is what shows on our skin. So, maintaining good hydration, eating good healthy foods, upping vegetables, fruits, all of that makes a big difference. And that's something you should teach them from the time they're young. Furthermore, as they get older, again, it's always going to be to cleanse or use a face wash, then a toner. A toner also just seals in the pores, and then a good moisturizer, again specific to the age that they're at, and a sunblock. Okay, as they get older, one of the things that we use more often now is antioxidant therapy, and that's topical antioxidant therapy, and that we use for more our older clients.
Yes.
So from around patients in their 25s, 30s, I would say, to be on a good topical antioxidant as well.
I just want to come in on there. I think there is still a place for facials. So I think in the teenage years, you still need those facials to remove those blackheads and whiteheads from forming, and you do that with the facials.
Yes.
And sometimes their skin's also still very young. You don't want to introduce harsh chemical products in terms of doing chemical peels at such a young age. So that's where the facials would come in, and then just teaching them about good skincare, and then maybe a green peel for them, or maybe doing like a very mild 5% chemical peel, something light, and obviously just informing them about sun care protection as well.
Fantastic. I think you need to go on a campaign on the sun care protection, because to get any of our kids to do that regularly is quite a task.
It is. It's difficult for us as it is.
Absolutely.
Get your kids on it,
But it's been such a pleasure having you here. I know that our time always runs so short, and we had lists of questions that people said to me, please ask them this, this, and this. And obviously I haven't gotten through half of it. So we'll have to get you back next year to tell us how to start off our year on good skincare, because I think we've got what we need, at least for the holidays, just to push us through and to make sure that we are cleansing and we are putting lots of sunscreen, which is most important. But I think you've given us a wealth of information in terms of what is available out there as well, and how to look after our skins, because there's enough options for us to make sure we have a good skin.
Yeah, absolutely.
Fantastic. It's been such a pleasure. Shukran so much for joining us in studio.
Thanks.
The fabulous Dr. Aisha Kola Adam and Dr. Muazza Umar have been joining us in studio, telling us all about the Crosby Medical Center and what they offer in terms of skincare and what's available to us out there. And I'm sure if you get hold of them, even if you're not in the Johannesburg area, they'll be able to direct you and advise you accordingly. We'll be taking a break, and when we come back, we'll be chatting to the therapist from Crosby Medical Center to continue the discussion. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. I just saw that ad from Islamic Relief, and that fits in so well with what we are talking about, the 16 days of activism. So go out and support them, because they definitely do a lot of work with regards to women and children in our communities and across the world as well. We went from one conversation chatting to two dynamic doctors, Dr. Muazza Umar and Aisha Kola Adam, about skincare, about finding out what we need to do to have the most effective and brightened skin. And now we're sitting with the therapist from the Crosby Medical Center, skin therapist Zaheerah Patel. Assalamu alaikum.
Wa alaikum salam. How are you?
Fine. It's such a pleasure to have you here. It's such a dynamic collaboration that you have between yourself and the doctors, and the holistic treatment that you give out. How did you get involved with the center?
So I'm a massage therapist, and I branched out into skincare therapy. And the doctors were so awesome in having me there and giving me a place in the aesthetic center.
I find this center, for me, what I absolutely love about it is, besides the fact that it's a collaboration of phenomenal women, it's also a collaboration that's putting people of color in the forefront of saying, you know what, we'll find out what's best for you, what works for you. How have you found the transition? Because I know the environment for you, you've come from another country, you've now settled here. How has the transition been for you to adapt to, from coming from a massage therapy point of view to dealing with aesthetics?
So I found it quite nice. I mean, I studied in face to face in Parktown, and it was a nice time for me. I always thoroughly enjoy beauty therapy. It's always it's a pleasure to do. It's nice to have women feel good about themselves, and you know, when they finished with their treatment, get up and say, they feel amazing, they feel fresh, they look good about themselves. So it's always nice. And I mean, from coming from overseas into South Africa, it was definitely a big change for me. Culture-wise, it's a big thing. You know, it's very different in London to South Africa. Also, the temperatures are really different. So
far more need for sunscreen here.
Exactly.
What I loved about the center is how holistic the treatments are, that with any patient coming in, the doctors are also advising and saying, actually, maybe try this, do this as well. Do you find the collaboration works with every patient that comes in?
Yes, most of the patients. I mean, you know, I suggest to the patients that, you know, they would benefit highly from doing a glutathione IV, or maybe a Maya's cocktail drip. You know, if I feel that they need a boost in energy, if they, you know, as we begin our treatments and as I see how their patterns are, how their skin is looking, what do I feel that they need, I then suggest, okay, no, you know, you should see doctor for this, or it happens vice versa.
Yes.
Doctor sees the patient first, and then, or the client first, and then she would say, no, I would recommend you see Sadia for the peel, or you do the green peel, or you do some laser for your hair removal. You know, if they feel that they're struggling with extra hair growth, and they'll say, you know, you'd benefit with that. So it's awesome having that, you know, balance between the doctors and myself.
It's fantastic. And I have to just say something before I carry on asking her questions. Each of these ladies sitting here have the most beautiful glow on their faces. So the first thing I'm going to do when I get off air is ask them what they've done. MashaAllah. Sadia, with regards to lasers, that's the one thing the doctors just touched on briefly, but I know that's something that's where your forte lies.
Yes.
every time when laser treatments came out for hair removal, it was a big thing. People were discussing it, but then the side effects became very prominent as well, with people going for the wrong types of lasers, getting burned, not having proper long-term results as well.
Yes.
Tell us a little bit about the lasers that you have.
Okay, so basically you have the 4, if you're looking for something for hair removal, you get 4 main types of hair removal lasers, which namely are the ruby, the alexandrite, the ND-YAG, and the diode. Those are your best hair removal lasers. They are quite costly, but then also you get the IPL with combination of the RF. So you get, which is called the E-light. So it depends obviously on what you're looking for. And my tip would be, make sure you're going to somebody that you know that they've studied and they've researched about lasers and they've been trained on lasers. Because if you don't know the settings of the laser, you can easily burn somebody, because we're working with light and wavelengths and nanometers, and it's a dangerous thing. So make sure you know who you are going to before doing the treatments, and make sure, you know, a good thing is before they do any treatment on you, that they assess your skin type and see that you know, what is your skin type, what medications you're taking, what things you know, what maybe you have a illness or something. So make sure that they have a detailed medical history before doing any type of laser treatment on you.
I know we've got to go for an ad break, but before we go, I just want to close up this conversation with regards to the laser hair treatments. There are 2 things that I always wonder about. We've seen very often ads advertising lasers that you can utilize in a home setting. How effective is that? And again, it comes back to what you just said now. If you don't know the settings that you're using it, can you have one setting for everybody?
Well, that's a good question. I mean, I've also seen a lot of these home IPLs and home laser type of devices. I mean, I would rather not, because you don't know if you can burn yourself. And, you know, if you do, I mean, it's really sad, because then you have to deal with the scar or, you know, damage to your skin. And it's hard to go back from a scar.
Yes. And then the second question that I had was, how effective are the laser hair removals? Is it, I know it may not be lifelong, but is it effective in eliminating the unwanted hairs?
Yes, definitely, definitely. It really does help. And you would find, obviously, later on, after a good few years, you might have a regrowth in some hairs because of due to your hormone levels. You know, hormones are such a funny thing. It just goes up and down, and you do tend to have some maybe regrowths of hair. So you know, it's a good thing to have a maintenance program after your laser. So after, you know, a few months, you just keep on going to just maintain the hair removal.
Perfect. We'll be taking a very quick ad break, and when we come back, we continue our conversation with the skin therapist from the Crosby Medical Clinic, Zaheerah Patel. Stay tuned. Welcome back to the last segment, where we're chatting to skincare therapist Zaheerah Patel. Zaheerah, one of the callers that we just had in during the ad break was Fatima, asking us about pigmentation on the foreheads. I think she may have tried to get through when the doctors were on air, but I'm sure you can answer that as well.
Of course, yes.
How, she said she mentioned specifically having pigmentation on her forehead area. How do you treat that, and how do you get rid of it, or how do you even start with that?
Okay, so my first suggestion would be is we need to assess what type of pigmentation it is. What was it from? I mean, is she having a hormone imbalance firstly? Is it could it be from some medication that she's on? Also, it could be post hyper-inflammatory pigmentation. So something due to a skin injury. She could have had that pigmentation from there. So maybe she's done something and it didn't, you know, it's just injured the skin and damaged the skin. So we need to first find out what it is exactly. And then obviously you need to see, I mean, what would be suitable for you, whether it would be a peel to help, or you could have a melanin reducing complex cream to stop the pigmentation and to correct it. Or we could also do some sort of Dermapen. Dermapen is good for pigmentation as well. So peels. So I would say,
can pigmentation be sorted out? I know, I'm assuming in the case of our caller, her one concern would be, can it be lightened? And also, can it be cured? Can it be sorted and fixed?
Like I said, it just depends to what degree the pigmentation is. I mean, we'd have to check that first. I mean, if it's slight pigmentation, a chemical peel should lighten it.
Yes.
It should lighten it progressively. I mean, and also in combination with that, use melanin reducing complex cream.
So you have to have a full package,
So
and as the doctor said, it's something that you need to be doing at home as well to ensure that it works both ways.
And then she really needs to make sure she's wearing sunscreen because it can further, you know, if she's in the sun, the UVA rays and the UVB rays can affect your pigmentation further. So make sure you're wearing a good sunscreen, that you're protected on both levels. Because, you know, with sunscreens, you need to make sure you look out for that both protection.
Perfect. Earlier, just now in your answer, you mentioned something about Dermapen.
Yes.
Tell us a little bit about Dermapen, and is it effective for everyone? I absolutely loved using the Dermapen. I loved the effects of it, but is it something that everybody should be using?
Well, it's not for everybody. I mean, it's specifically aimed at scarring, like, so more. How can I say, it's more for your more scarred treatments and things like that. I mean, it does help with pigmentation. It's micro needling, so you're effectively damaging the skin layer to encourage it to heal itself. So that's what you're doing effectively. So that's what it's doing. So it's mostly for scarring. So pigmentation, I would rather go chemical peel first with your cream. Make sure you're wearing your sunscreen protection, and then if still it's not helping, maybe go for something more harsher.
Yes. But the Dermapen obviously would be effective for people who've suffered from acne, who've really had severe acne growing up as well.
Yes, yes. I mean, yes. So, I mean, like deep scarring marks, like, you know, those type of things, that would help.
Perfect.
Yes.
Also, when it comes to facials, and we speak about, the doctors also mentioned on air, making sure, you know, you have a regular facial in your younger years, making sure you look after that. And then as we get older, we're going into chemical peels and that. From your perspective, tell us about the balance between the two and what it does.
So I would say, look, chemical peels and facials are both important. So the important thing to know about the difference between it is that a facial is actually for moisturizing properties, and it helps to cleanse the pores. So we do extractions, we do steaming, we do exfoliating, we do all those steps, and a nice mask to help lock in that moisture, which you really need. So that's the difference between a facial and a peel is more of a stripping away the surface, the dead skin of your face. So that's what it does there. So that's the difference between a facial and a peel. So it's important for you to do both things. So one to keep your moisture in, and one to help to exfoliate, so you're getting better penetration of products.
As we're getting older, we know we've spoken a lot at length about the fact that we've got different things we need to be doing with our skins, different things we need to be taking care of our skins. What would be your tip to people, to our viewers, in terms of ensuring good skincare on a regular basis?
So you need to have a good skincare regime. I would say from men to all ages, women, all ages, you need to have a good skincare regime. Cleansing is your first step. You need to have a good, nice cleanser, and it's always skin type specific. So you have to firstly identify what type of skin type you are. Are you oily? Do you have a dry skin? Do you have pigmentation skin? Do you have normal, or do you have a combination skin type? So you have to identify that first, because you don't want to be using a product, say, where you're using a product for an oily skin type, whereas your skin type is not oily, you are dry. Then you're going to be causing a different problem. So you have to make sure you have the correct product for your skin type. So have a good cleanser in the morning, nighttime. Make sure you're washing all that dirt off, because you know you're in contact with pollution, smoking, dust, all those type of things, and it always gets into the skin pores. So make sure you have a good cleanser, and then tone the skin. I mean, toner is now really rarely used, but use it because it brings back the pH balance of your skin. It helps to close those pores so that nothing else can go into them. And then also use a good moisturizer to help keep the moisture into your skin, and then obviously finally your skin, your sunscreen. And then exfoliation you must do every 2 to 3 times a week, because if you're going to not exfoliate, all that dead skin cells is just going to layer upon layer on your face, and then you're putting products on your face, but it's just sitting there, it's not going in. It's just going to sit there. So you need to make sure you exfoliate 2 to 3 times a week with a good exfoliator.
And how do you choose them? I mean, we're talking about the products. You're mentioning what we need to do. I must say, I know very often many of us get home late at night, we're tired. The last thing you want to do is cleanse your face, and you think, I'll be sorted out. And I'm listening to this, realizing actually that's the first thing we need to be looking after. But you mentioned exfoliation 2 to 3 times a week as well. How do you choose your products, from the young girls that are watching to us in our older years? How do we choose what are the right products for our skins? And you mentioned having different types of skins. So I've got 3 questions there. Number 1, how do you know your type of skin? The second question is, do our skins change as the years change? Can we go from having a combination skin to a dry skin to, and how do we keep up with that? And how often, start with that, and then I'll get to my questions. I've got so many.
Absolutely, absolutely. You can change from having an oily skin to going on to having a dry skin. Yes, definitely, you can do. So what you need to do is, for an oily skin, you have always that sheen on your face. It's mostly clogged. You can see you've got blackheads, you've got pimples, pustules, papules, those type of things on your face. That is the key thing to having oily skin, so that you can identify there. Obviously, dry skin, you can see now your skin is like dry. It feels very tight in the morning. After you wash your face, it's feeling tight. You can feel that. That is your dry skin type of skin. And then your combination skin type is on the maybe on the forehead and the nose area going down to your chin, which is normally the T-zone. That is more on the oily side, so you'd find only you have imperfections on those areas, and then your cheek feels a bit dry. That's your combination type skin. And then obviously normal skin types are very rare because that's like your perfect skin. It's supple, it's moist, it's clear. Those are kind of rare.
If you have that, you are blessed.
If you have it, you are totally blessed. Yes, and then you just need to just upkeep it. You just need to choose the correct product. Obviously, firstly, your exfoliator, you get 2 types. You get obviously the mechanical type of exfoliator those are your granular type of exfoliators, and then you get your chemical type of exfoliators, or your enzymatic exfoliators. Chemical meaning your salicylic acids, lactic glycolic acid, those type of exfoliators. And then your enzymatics, which comes from pineapple, papaya, those type of and exfoliators. You need to know, obviously, salicylic is for oily skin. So if you're choosing a product exfoliator for your oily skin, those are the ways to go. If you're choosing something just for a normal, you have a combination type of skin, which is quite often a lot of us have combination skin types. We find on our cheeks we're dry, and on the T-zone we're a bit clogged. So go for those type of mechanical ones. Go for those type of ones, or even just a normal glycolic type of exfoliator. That works brilliantly, because it just helps you to lift all those things out of it. But don't go over 2 to 3 times a day.
Perfect.
I mean, a week.
Week. Yes.
Yeah.
Zaheerah, it's been such a pleasure having you. I know that we have a list of more questions to ask you. Unfortunately, our time is running out. Very quickly, last question. How often should we be changing our products?
So products, I mean, if it's working well for you, stick with it. Don't change it. You don't need to. If it's not working, then I would look at changing something.
Fantastic. Shukran so much for joining us on air.
Jazakallah for having me.
These ladies are absolutely fabulous and truly wealth of information. I have no doubt that if you contact them, they will direct you in the right way, on the right path, and to make sure that we have beautiful skin going forward. Look after yourselves during this holiday period. Travel safely, whether you're traveling abroad, whether you're traveling locally or just staying at home. Be safe, look after yourselves and your families. Remember our team in your du'as as well. It's been an absolute pleasure sharing this year with you. It is our last show for this year. You will be seeing other shows, but they have already been shows that have been recorded through the year. We look forward to being with you again next year. Remember all our Muslim brothers and sisters around the world in your du'as, and let's make a difference. Let's be conscious Muslims, conscious citizens throughout this holiday period, and make it easy for everyone around us. Have a wonderful, wonderful time, and we'll be in touch, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.